If you feel dizzy, have labyrinthitis, take some medicine and think that's solving the problem, look, maybe you're just covering up, masking your symptoms. And even worse, right? You're actually prolonging the problem. Today, I'm going to show you why common medications don't solve dizziness and what the right treatment is for your dizziness, for your labyrinthitis. Hey everyone, how are you? I'm Dr. Saulo, a neurologist. And one of the biggest mistakes I see in my office is when a patient comes in and says, "Doctor, I took medicine for labyrinthitis. I got a little better. I even felt fine, but then it came back and it came back strong." Or even worse, okay? "Now, doctor, I feel dizzy or even dizzier than I was before." Or, I didn't get better at all. I took the medicine for nothing. The problem, folks, is that there isn't a universal one-size-fits-all medicine for every type of dizziness. Those labyrinthitis medicines that people use out there don't treat the cause. They only relieve the symptoms, put out the fire for a while. I'll mention in a moment the trap medicines you might have used out there. But first, I want to tell you that there are dozens of causes of dizziness. Dizziness is a symptom, folks, not a diagnosis. So I need to find out what is the cause of what's being called or nicknamed labyrinthitis in order to provide the right treatment. To give you some examples, there are cases of dizziness and vertigo that can be caused by problems in the labyrinth. There are at least 7 diseases. By diseases in the labyrinth nerve, at least 4 diseases. By dozens of neurological diseases that happen in the brain. And even by metabolic problems, blood pressure issues, and so on. And for each of these diagnoses, for these dozens of diagnoses, the treatment is completely different. And comprehensive treatment also involves other professionals, such as speech therapists or physical therapists who provide vestibular rehabilitation, nutritionists for dietary management and nutritional protocols, and psychologists for behavioral therapy. So, to satisfy your curiosity, I'll give you some examples here. Don't be surprised by the strange names of the diseases, okay? We're terrible at naming things. There is an international society, the Berani Society, headquartered in Sweden, which standardizes the official nomenclature and diagnostic criteria. I'm the neurologist who represents Brazil, and I've already joked there that we're terrible with names, okay? But let's get to it. First, we have BPPV, benign paroxysmal positional vertigo, which is the so-called crystals in the ear labyrinthitis. It's the most common cause of vertigo. The person feels like everything is spinning, turning, or swaying with nausea and discomfort when they turn over in bed or look up, for example. In other words, with specific head movements. Do you know what the right treatment is? A repositioning maneuver, such as the Epley maneuver, for example. I don't need to take medication for BPPV, so what I'm telling you now is that the main cause of vertigo in humanity is treated without medication. Can you imagine how many people across Brazil and around the world are taking medication unnecessarily when in fact it's a maneuver that's needed? In just a few minutes, with a maneuver in the office, the patient can leave without any symptoms. Second example, Meniere's disease, which involves long-lasting vertigo attacks lasting at least 20 minutes along with auditory symptoms, meaning that together with the vertigo attack, there is pressure or a feeling of fullness in the ear, which we call aural fullness or ringing in the ears, or the sensation of reduced hearing. And over time, between the attacks, over the years, there is also progressive hearing loss and chronic tinnitus. Do you want to know the right treatment? There are specific medications to shut off the little taps in the inner ear that are producing more fluid than they should. Specific vestibular rehabilitation for the disease. Nutritional care tailored to the disease. We can use transcranial magnetic stimulation to modulate the tinnitus. And behavioral therapy is also an option because many people with Meniere's disease suffer from anxiety due to the vertigo attacks. Taking a generic medication without adjusting your lifestyle, without having this complete and assertive treatment, won't help at all. Maybe it will you might avoid another episode, but it will come back full force and the other symptoms will get out of control. A common mistake with Meniere's disease is abandoning treatment. People who are doing well with Meniere's disease treatment sometimes feel so confident and so good that they stop the treatment. This causes the disease to return, sometimes even more intensely. The third example I want to bring up is vestibular migraine, which, in addition to causing headaches, also triggers vertigo attacks. So at least half of the person's headache episodes are accompanied by severe dizziness, vertigo attacks, and often nausea. Do you know what the right treatment is? Preventive medications for migraine. There is a huge group of medications that we can use. There is botulinum toxin, preventive Botox for migraine, and there are monthly antibody injections for migraine prevention. In addition, changes in sleep patterns, some dietary controls and precautions, stress management, vestibular rehabilitation will be very important. Transcranial magnetic stimulation can be a tool, and even behavioral therapy in some cases. Just taking antivertigo, anti-migraine, or anti-headache medication during an episode masks and covers up the problem, but it doesn't solve it. It's not a definitive treatment. The best thing is to prevent both pain and dizziness episodes from happening in the first place. The fourth example is vestibular neuritis. Look, the nerve of the inner ear suddenly becomes inflamed, causing intense, severe vertigo that lasts for hours, sometimes days, along with intense imbalance. Sometimes the person can't even get out of bed when they're experiencing the acute phase. And recovery happens very slowly over the course of days and weeks. Want to know the right treatment? I have up to 14 days to start corticosteroids at a proper dose in a sufficient amount for the right duration to help reduce the inflammation of the nerve. Vestibular rehabilitation should be done by a competent physical therapist or speech therapist in this area, and I must not overuse inhibitors or antivertigo medications. Take a look here. If I overuse medications for labyrinthitis, I just mask the problem a little, but I interfere with the system's recalibration. I hinder the recovery of that damaged nerve. So this can lead to lasting after effects. So look, in this case, it's the opposite. If the medication, the anti-vertigo drugs, are used improperly, they will actually be harmful to recovery. So just lying in bed, taking medication, stuffing yourself with anti-vertigo drugs can delay recovery and greatly increase the chance of lasting effects. The fifth example, of course I had to mention it, is PPPD, persistent postural perceptual dizziness, formerly known as phobic vertigo. It's that strange, weird feeling in your head that's hard to describe. Sometimes you can't even explain it to your doctor, your family member, or your friend because the sensation is just so strange. Lightheadedness, empty head, big head, heavy head, loose head, floating head, different head, walking on eggshells, floating. There are many sensations that torment the lives of those with PPPD. And the worst part is that it's constant, it's a chronic dizziness, it's there most of the time, every day of your life. And there's a strong sense of postural insecurity, as if you're afraid or worried about falling. A feeling of insecurity when walking, a sense of instability, even though these are people who never actually fall. And also, along with the condition, there is a worsening of symptoms in visually busy environments like a supermarket, a shopping mall, an airport, a church, or a pharmacy. Want to know the right treatment? A combined approach using specific medications to recalibrate the brain's serotonin, along with a repertoire of vestibular rehabilitation, specifically for PPPD, including postural safety training, progressive visual stimulation, behavioral therapy, because yes, PPPD causes a lot of anxiety, a lot of fear, a lot of stress, and some people even become depressed because of it. Nutritional care, and we can also make use of transcranial magnetic stimulation as a way to enhance the treatment. A common mistake in PPPD? Using vestibular inhibitors, anti-vertigo medications, which only make things worse in the long run. They won't even make a dent in PPPD, they won't help at all. And the other mistake is thinking that there is no treatment. Thinking, you hear people say it's just emotional. No. It's a real disease. It's an organic neurological condition, and yes, it does have treatment. Don't give up on seeking help. And here's an important reminder, okay? Vestibular inhibitors, anti-vertigo medications, they're only going to numb the system. Which system? The vestibular system, it has nothing to do with college exams, okay? But it's the system involved in cases of dizziness and vertigo. So they numb the system and help the person get out of a vertigo episode more quickly, more efficiently. Which ones are they, okay? Let me give you some examples here, all right? Dramamine, good old Dramamine, Meclizine, which is Meclin, ondansetron, which is Vonal, which is also known as Nalzedron, and even Betahistine, which is Labyrinthitis, beta-circ, which is a weak inhibitor, okay? Which we don't use in the context of acute vertigo. We use it for Meniere's disease, which is a different situation. There's also Cinarizine, which is Stugaron, Vertix, and Flunarizine, which is Vertizine, among others. So these medications, be careful, okay? You should only take medication prescribed by your doctor, and you should only use those anti-vertigo drugs, the one that's exactly right for your case, exactly for you during a vertigo crisis, and only when your doctor instructs you to use it. Taking these medications on your own without guidance, self-medicating, can cause terrible side effects. I'll even give you an example, okay? For example, with Dramamine, 80% of people will feel drowsy. Meclizine is the opposite. 80% won't feel drowsy, but 20% will. But they can also, in some cases, cause difficulty concentrating, memory changes, or leave the person somewhat sedated. Cinnarizine and flunarizine can cause weight gain. A lot of people gain weight like this rapidly because of the excessive use of these medications. They can cause Parkinsonism, tremors, and rigidity. In other words, symptoms that mimic Parkinson's disease. See you next time. Even depression. Guys, be careful. Never self-medicate. See a doctor. Only take medication prescribed by your doctor. And the worst part, okay? In this whole situation of medication abuse, you're still dizzy because the cause wasn't identified and the cause wasn't treated. The truth is simple. You can only really treat dizziness when you know where it comes from. Here I mentioned a few examples, okay? There are many others, dozens of conditions. This video would be extremely long if we tried to cover them all. Want to know more about the various causes of dizziness? Take a look at the playlist. There's a lot of great material there about dizziness. So, there's no magic formula, but there is a solution. If you or someone you love keeps taking medicine for labyrinthitis without getting better, share this video. Maybe what's missing isn't more medication, but the right diagnosis. Here on the channel, I make topics related to dizziness easy to understand, and my wife simplifies topics related to psychiatry, mental health, anxiety, depression, bipolar disorder, and OCD. Everything here is based on science and presented in accessible language. You know what? Don't be silly. Subscribe to the channel so you don't miss the next video. Take care.